You know that feeling, that throbbing, nagging, just relentless earache that won't let you think about anything else? We've all been there. It's one of the top reasons people end up at the doctor's office. But what is actually going on inside your head? Well, today we're going to play detective and crack the case of the common earache.
So let's get right into it. Because that pain you're feeling, well, it might seem pretty straightforward, but it could be one of two totally different scenarios. We're talking about an inside job versus an outside job, and figuring out which one you're dealing with, it's absolutely crucial.
The two main suspects in our investigation are otitis externa, which is an outer ear infection, and otitis media, an infection of the middle ear. Now, they both cause that same awful pain, but they happen in completely different parts of the ear, and for completely different reasons.
Okay, first up, let's talk about the outside job. You've probably heard of this one, swimmer's ear. This infection happens right there in the ear canal. Yep, the part you can actually see and, well, probably shouldn't be touching.
So, what is otitis externa? Really, it's just an infection of your ear canal. The easiest way to think about it is like a skin infection, but one that's happening in a very sensitive, very narrow tunnel. And that's exactly why it causes so much pain.
So how does this whole thing kick off? It all starts when your ear's natural protective shield, that waxy, water-repellent layer, gets broken down. That sets off a chain reaction. The skin in the canal gets inflamed and starts to swell up, which then traps moisture and any bacteria inside. And here's the crazy part. Your body's own defense, that inflammation, is what actually creates the perfect, warm, dark little incubator for an infection to really set up shop.
So, what's breaking that barrier in the first place? Well, the number one trigger, no surprise, is extra moisture. That's why swimming is the classic culprit. It just washes away all that protective earwax. But it's not just water. Any kind of skin injury, like from using cotton swabs, please don't. Or just scratching an itch, even the constant rubbing from hearing aids or earbuds can create tiny little breaks in the skin that let bacteria sneak right in.
And you can probably guess what happens next. Once that moisture is trapped in there, you've got a dark, wet, and slightly alkaline environment. This is basically a 5-star resort for a particular bacterium called Pseudomonas. This bug loves water, and it's almost always the main troublemaker in this kind of infection.
All right, time for our second case file, the inside job, or otitis media. Now this infection, this one happens in a hidden air-filled chamber behind your eardrum. It's a place you can't see, you can't reach, and that's where the trouble begins.
See, your middle ear is supposed to be this dry, ventilated space. It stays that way because of a tiny little drain pipe called the eustachian tube, which connects it to the back of your throat. Its whole job is to keep pressure equalized. But when that tube has a problem, the entire system just goes haywire.
Imagine that eustachian tube is the drain in a sink. When it gets clogged, everything backs up. First, you get this weird negative pressure that actually sucks the eardrum inward. Then, fluid that can't drain out starts to build up behind it. And that fluid becomes this stagnant little pond where bacteria can have a party, leading to a full-blown infection. All that infected fluid creates immense pressure that starts to painfully push the eardrum outward. And what clogs this drain? By far the most common trigger is just a regular old cold. The inflammation from the virus swells that eustachian tube shut. The same thing can happen with bad allergies, and in kids, sometimes it's enlarged adenoids that are physically blocking the tube's opening.
This brings us to a really important point, and it explains why it feels like every toddler you know has had a million ear infections. It's all about anatomy. A kid's eustachian tubes are shorter, they're flatter, more horizontal, and they're just floppier than an adult's. This makes them way easier to block.
Okay, now most earaches are just really painful annoyances that go away with treatment. But we do have to talk about what can happen when they aren't dealt with properly. Both types of infection, though it's rare, can spread and cause some very serious problems.
For that outer ear infection, the big worry is the infection spreading into the bones at the base of your skull. That's a condition called malignant otitis externa. For a middle ear infection, the concern is something called mastoiditis. That's when the infection works its way back into the big mastoid bone you can feel right behind your ear.
So, what's a major red flag? A fever. A simple outer ear infection usually won't give you one. So if you see a temperature climbing over 38 degrees Celsius or 104 Fahrenheit, that's a huge sign that the infection is more than just skin deep. It strongly suggests it's a middle ear infection, or maybe that an outer ear infection is starting to spread.
All right, so how can you actually tell the difference at home? Let's get practical and look at the key signs that help distinguish an outside job from an inside job.
The number one, absolute biggest clue is pain when you touch your ear. If you gently pull on your earlobe or push on that little flap of cartilage in front of the ear canal,
That's called the tragus, and it sends a jolt of sharp pain. It's almost definitely an outer ear infection. A middle ear infection causes a deep, internal, pressure-like pain, but you can touch the outside of your ear all you want and it won't hurt. And, like we just said, a fever is pretty common with those inside jobs, but super rare with the outer ones.
So if you remember one thing, remember this simple trick, the tragus test. It is one of the most reliable ways to suspect an outer ear infection. If there's no pain at all when you do that, then you should probably start thinking it's more likely an inside job.
So why does all this matter so much? Because the treatments are completely different. An outer ear infection needs antibiotic ear drops that can actually get to the infected skin. But a middle ear infection is trapped behind the eardrum, so it needs oral antibiotics to work from the inside out. Getting that diagnosis right means you get better faster, and it helps prevent those serious complications we talked about.
And that really brings us to a final, interesting thought. In both of these cases, it's the body's own defensive reaction, inflammation, that ends up trapping the bacteria and causing all the pressure and pain. You know, inflammation is supposed to protect us, but when you're dealing with the tiny, cramped spaces of the ear, you have to wonder, is our own defense mechanism sometimes the main accomplice in the crime? Something to think about.